as a reminder, we right now have this conversation is available obviously on this primary channel in English. However, you can also join this conversation where we have provided simultaneous Spanish translation via the Buncombe County Health and Human Services Facebook page. We welcome all of our attendees today, whether you're watching on Zoom, Facebook, or YouTube, to share your questions via the chat. And as we proceed and during the Q&A, we will share all of those that have not been already discussed during our panelist presentation. And so before we begin, I would like to open the floor to have all of our panelists introduce themselves. And with that, we will start with Denise.
Hi, my name is Denise Duckett. I am a pregnancy care manager. I am employed by the Department of Health and Human Services. I am outposted as a care manager at Mayheck OBGYN.
I'll go next. Hello, my name is Claire Fontana. I'm a nurse home visitor, a registered nurse with the Nurse Family Partnership Program of Buncombe County through Health and Human Services. Welcome, everybody.
My name is Kimberly Williams. I am a breastfeeding peer counselor with WIC on Cox Avenue, and I will be speaking on how to work in the community with breastfeeding.
My name is Christina Sliver. I go by Chris. I'm a mother, just recently given birth, and I'm here to talk about pregnancy and birth during COVID.
I'm Georgiana Cogburn. I'm the Region 1 lactation trainer. I work at the Mountain Area Health Education Center and train people throughout Western North Carolina to support breastfeeding mothers.
We also have joining with us today, although she is not on video. Oh, wonderful. Nikita.
Hi, I'm Nikita Smart. I'm one of the South Sisters Caring for Sisters community-based doulas out of Mayheck. Hi.
Welcome. Well, so glad to have all of our panelists on. And before we have our first presenter, wanted to share some numbers on whether, are we heading for a baby boom or a baby bust, which is, means that, we're seeing less births than we typically would anticipate. So far for 2020, we in Buncombe County have had at least registered births. And so these are births that have actually been registered through our vital records department, 2,724. And this is from January through September. And so what that looks like in prior years. So looking back to 2019, by this time we would have seen 2,844. And in the years prior for 2018, that was 2,880. And in 2017, 2,668. There's lots of information into why we may be seeing what it looks like a slight dip from 2019. It's possible that many families opted to have a home birth and have yet to register their birth, as sometimes that can take up to a year. It's possible that this, many families have possibly decided not to, or possibly did not, have yet to, register their births, among others. And so we will know much more about those numbers in the coming months. And in the coming months, we'll see some of our first babies that were actually conceived following our local COVID shutdown. So we may see those numbers increase quite considerably, as many of us have been home much more. So with that, I will now give the floor to our first presenter, Denise Duckett, again, a pregnancy care manager with the care coordination team for Buncombe County. Denise, welcome.
Hi, everyone. Again, my name is Denise, and I am a pregnancy care manager, again, working for the Department of Health and Human Services. Pregnancy care management is a program. It's from the state of North Carolina. It's out of every 100 counties in the state. In Buncombe County, we are in every practice in this county. Basically, our goal is to make sure that we can help women have a full-term pregnancy outcome. How do we do that? We want you to have not have a low weight birth baby, and we want to prevent preterm deliveries. So what we do is we meet with you and we try to do an assessment with you when we first meet with you, and also develop a care plan. We get referrals from a couple of different places. We get those referrals from the prenatal provider. You can also self-refer. So after we meet with you, what we do is we develop a care plan. After that care plan is developed, we will meet with you either weekly, monthly, or we will meet with you every couple of months or so. And this depends on what we get out of that meeting. Now, we normally would meet with you during the visit to your doctor's office. During COVID-19, not so much. So there are phone calls that are made. Also, we would normally do home visits. Those are still taking place, but not so much during COVID-19. But we are still making contacts with you. A lot of those contacts are being made, again, over the phone. What are we doing during those contacts? We're doing quite a few things. One, we're making sure that we reconcile your medications. We want to make sure that you're able to make it to your doctor's appointments. We discuss what's happening at your doctor's visits. We want to make sure that you're able to get your medications that you're being prescribed. We want to coordinate your medical visits. And most of all, we want to address that care plan. If there are things that aren't happening that need to happen, we want to help you with that. We also make referrals to several resources depending on what we discussed in that care plan. It's different with every single woman. So one visit isn't the same as another visit. So there are numerous resources out there. There's WIC, food stamp, childbirth classes, breastfeeding. We refer to doulas, nurse-family partnership, transportation, among other resources. So we will also advocate for you. There are several ways to do that. Again, I want to go back to the fact that it's individualized. So what happens with one woman isn't what happens to another woman. So again, care managers are embedded in these practices. So we have contacts with the providers. So that makes it a little more easier for us to advocate for you. If, for instance, you want to see the same provider, then we can advocate for that. If you're having difficulty getting in for your visit, then we can advocate for you, and so on and so forth. So we also can advocate for you with the pharmacy. There are times when you're being charged the $3 for a prescription, when as a pregnant woman on Medicaid, it should be a $0 copay. We also address things in the community, such as housing, childcare, other things. We provide additional referrals as well to physical legal services, HelpMate, 211, to food banks, pantries, local shelters, if that's what you may need. We also assist with getting things for your baby, bear closet, safe kids. This service takes place for the entire pregnancy, and we work with you throughout the 2-month postpartum period. And I want to make sure that I also mention that this is for women who have Medicaid or who are uninsured. So that is kind of the gist of pregnancy care management services.
Thank you so much, Denise. Before we welcome our next panelist, I'm just curious if you could touch upon, you did mention that this was for Medicaid recipients, but is there a cost? And if, let's say, you do not qualify for Medicaid, can you still also benefit from the program?
Absolutely. There is no cost for this program. It is free. It is for women who have Medicaid and who are uninsured, but it is no cost to you. And again, you can self-refer. Usually it comes from your doctor's office, but if you feel a need and you hear all the things that I'm talking about right now, you can self-refer. You can do this through WIC, through your doctor's office, or you can do this through the health department, the Department of Health and Human Services.
Excellent, thank you. Really, really informative. I'm so glad to hear that our moms and our babies, do have this resource to really help them navigate through all that is out there. So next, I'd like to welcome Claire Fontana with Nurse Family Partnership. Claire, very happy to have you. You have the floor.
Hello, everybody. Welcome. Like I said, my name is Claire Fontana. I'm a registered nurse with Nurse Family Partnership of Buncombe County. I'm honored to be on this panel and just want to give a shout to all the amazing community partners I'm seeing on the screen and ones that aren't here with us today. I'm speaking from a home visiting perspective, and I also just want to acknowledge so many home visiting programs working with families in our community. ABIPA, Mother Love, Verner, Project NAF, CDSA, just to name a few. So, Nurse Family Partnership, or NFP for short, is an evidence-based program that began in the 70s. It's a voluntary program. It pairs a first-time mom with a specialty trained nurse, and to conduct regular home visits through pregnancy and then until the child's second birthday. The program, it's a strength-based program. We recognize the client is the expert of their own life, and our focus is on the client's life goals, their family's health and well-being, and we honor and follow the client's heart desire. Since its inception, NFP has grown to serve over 330,000 families, and it's active in 40 states. There's many sites around the state of North Carolina too. Buncombe County was implemented the NFP program in 2009, and we'll celebrate our 11th year next month in October. And it's always been seated at Health and Human Services. 3 years ago, we expanded our program beyond first-time moms and now can serve families with other children. We're a team of 10, so there's 8 nurses. Each nurse works with 25 families, and at full capacity, we serve 200 plus families. To participate in NFP, it's a voluntary program, so a client would enroll, and they need to enroll in the prenatal period, and they need to be eligible for Medicaid or WIC, and it's a free program as well. We serve a really diverse population of families through the county, and we have the capacity to serve non-English speaking families as well. Spanish-speaking families, Russian-speaking families, and beyond. NFP is primarily a home visitation program, and so, we'd meet clients at their homes or a location of their choice. I've done visits in Ingalls, at parks, and schools, sort of all over, bus stops, family friends' houses. So it's really whatever works, and we'd meet on a weekly or bi-weekly basis, and during visits, we provide nursing assessments, parent education and support, and link families to medical and community resources as needed. So in March, when COVID, really became the crisis in our community, we were able to quickly pivot from home visiting to a telehealth model. Previously, we've been able to utilize telehealth on some occasions, but it became clear this would be our primary way of doing visits. And the National Service Office of Nurse Family Partnership has really offered guidance to proceed with only telehealth for now for the health and safety of families enrolled in the program. But we've really been able to stay well connected with clients through phone calls, texting, FaceTime. We have access, we started using a HIPAA compliant platform called DoxyMe to do virtual visits. And also just recognizing maintaining telehealth can be difficult, as many families in our county have limited financial resources for cell and internet service. COVID-19 also has placed an increased hardship for families in meeting their basic needs. More families in our program have needed support with food, housing, and essential supplies, as well as increase for emotional and psychological support. Working with our community partners, we've been able to help families get food, diapers, wipes, masks, infant supplies, as well as just helping link them with resources regarding housing, childcare, mental health support, to name a few. On average, we're delivering to 50 or more families a week. The warm weather in the spring and summer has been nice and provided some opportunity to be outside at a distance when we make drop-offs, like wearing a mask, and at least connect briefly, which has been really nice. We've been able to provide some nursing assessment as well, so maybe weighing some infants to monitor baby's growth if there's some concern, and just checking in. Some blood pressure checks for pregnant and postpartum women that are high risk. And, you know, we continue to work with community providers, doctors' offices, you know, so many other resources. We've adjusted our service delivery model like many other healthcare providers. However, it's important that we acknowledge that our changes and the changes for other providers are part of a larger disruption in the lives of families we serve. For example, and you know, a lot of support is around things like this. Like clients we work with can sometimes have trouble accessing prenatal care or health care in general. It can be challenging when you don't have childcare and you can't bring your children with you to appointments. You know, celebration times like an ultrasound appointment to get the first pictures of your baby are different when you can't have your support team with you. While we don't have answers and we can't change that, just listening and acknowledging that change is huge, I think. And also some families have been quarantined and in isolation, needing food and essential supplies delivered because they can't leave home. Some families have experienced great losses, losing family members and friends to COVID-19, losing their housing and livelihood. Families are struggling to get enough work hours to support themselves. Some are frontline workers in our community, concerned about their health and about bringing COVID into their households. Also struggling to ensure their kids have support they need to do online school. We see an overall increase in family stress. There's a lot on parent shoulders through this. And while there's aren't always easy, fast solutions, there's value in listening and hearing, and there's a lot of value in honoring the resilience families continue to express and build. And at NFP, through Buncombe County, we're dedicated to walking with families through this time. So, thank you.
Well, thank you, Claire. And it sounds like you all are really helping address the need for connectivity for some of our families who, you know, may face some challenges. Could you please share again the virtual platform that you all are using as you know, the bridge for telehealth in NFP? Yeah,
it's called DoxyMe, and it's HIPAA compliant. I think they started using it at the health department and in the clinic, and I haven't done it yet with a client, but I have my first one this week, and we're going to work on CPR together through the videos chat. So I think that would be like a nice way to try how to do it. I don't know.
Well, you know, having seen you work in the community and work with clients, I'm sure that you'll do well, and I'm excited to hear that this DoxyMe is also being used in other aspects within the Buncombe County Public Health Services. So thank you so much for that update. And so continuing along, another familiar voice in community health, particularly in infant and maternal health, is none other than Nikita Smart. So Nikita, I will now open the floor for you, and before we begin, ask you to please unmute so all of our viewers can hear what you have to tell us about the state of being a doula, Sisters Caring for Sisters, and your work during COVID.
Hi, everybody. Let's see, how do I start this? Let's start with what is a doula. So a doula primarily is a trained, certified professional labor support person And we typically offer 4 pillars for our moms. And those pillars are evidence-based education, preserving the memories, so that's like helping her take pictures during her birth, comfort measures and physical measures, so that's like hip squeezes, massages, foot massages, whatever that looks like for mom. And our 4th one is emotional support. So that emotional support sometimes can come in the form of supporting mom, partner, a family member. We're typically there for moms, but we provide the emotional support for partners and family members also. What makes a doula? I think a lot makes a doula, because what happens is scientifically, doulas help decrease cesarean rates. We help lower the Pitocin intake for moms. We try to help our moms initiate labor on her own. And we just, we try to help her have the best birth that she can, but always with the understanding that sometimes stuff happens, but she's prepared for that because we've had those conversations. We work closely in the community with Denise, which is the pregnancy care managers in Mayheck. We work with Nurse Family Partnership. We make referrals to them. We get referrals to them because this is really all about supporting our moms in the community during this time. COVID's hit hard for a lot of these moms, and they are not really understanding how to deal, but with resiliency, they're doing the best that they can. So sometimes the pregnant mom can get stressed out and not even know that she's just that stressed out. We've been doing this for a while. We started in the community in 2016. And we've served probably about 150 moms within Buncombe County, but Mayheck being the safety net for surrounding counties for high-risk moms, we serve outside of Buncombe County. Like, I'm currently on my way to Franklin to deliver a food box, but I'm parked now. Changes in my work since COVID, like, it's been hard because with the COVID restrictions for a while, we weren't allowed at the doctor's appointments, we weren't allowed in the hospitals, and because we know the maternal and infant rates for African American women and children, we were scared, not only for ourselves, but for our moms that were delivering during this time. So what I'm very happy about right now is that Mission has started letting us back in the hospital. It's giving some of our moms a little assurance that they're knowing they're there. I just spent my first prenatal inside of Mayheck with the mom, and she was so excited. She's like, I haven't had anybody with me at all of these appointments, and now somebody gets to come. Yay, I don't have to be alone anymore. And those are the things that we like to support. Thank you.
Well, thank you to you, Nikita. It's very clear that a doula's work is never done. And congratulations to you for this first milestone of getting this first in-hospital prenatal visit following some of those restrictions that many of our providers had to adhere to during COVID. Also, wanted to circle back on something that Nikita did bring up around the infant mortality rate. For all of those who are joining today's conversation who may not be aware, Buncombe County Health and Human Services, through our community health improvement and health assessment cycle, are working with our partners, and Nikita is very much connected to many of those efforts, as all of our other panelists, in helping us reduce the racial infant mortality disparity between Black and white babies. In Buncombe County, Black babies are 3.8 times more likely to die within the first year of life, and our county, along with our partners, are all working through collective efforts to reduce and hopefully eliminate this disparity. And so we thank Nikita. We know doulas are a very important strategy in this, as is breastfeeding, care coordination, and home visiting, as all of our contributors are here today. And so with that, we are here wanting to hear at least from someone who has actually recently had a baby during this time in COVID, and welcome Chris or Christina, who can tell us a little bit more about what that experience has been like as a mom, and also for the family. And, you know, we'll hear about what it's been like to experience some of those milestones and memories during COVID-19. Chris?
Thank you. Yeah, it is such an honor to be on this panel with all of you. It makes such a huge difference having what I would call a super team. All of you and your organizations really do make a difference. Oh, and I hope I don't cry. I'm going to call hormones on that. I just gave birth 3 weeks ago to my second child. My husband and I have a 4.5-year-old, and it was a very different experience this time around. You all actually kind of touched on being there for mothers, and with my second one, I felt with COVID, I was just, I was in my second trimester, just starting my second trimester when we kind of went into isolation and things really changed. I was set to have care with the WNC Birth Center. And of course, they went to telemed for most of their appointments. And I felt alone for a lot of what I went through. You know, it was different than my first, where my husband got to come with me. We chose the birth center because it was family oriented. I could bring my daughter and, you know, have my kind of birth team with me kind of the whole way through. And when COVID hit, that kind of went away and it was just me. And I felt really like, okay, I can do this. But I really felt like I was by myself. This pregnancy was my own and my own to carry. And it was when I went for my ultrasound by myself that I just kind of broke down, and I was like, this is too much. But luckily I had a doula, and I called her and I was like, oh look, sorry, getting a little, whew. Anyway, yeah, it was my doula who just was able to be there for me and listen. My midwives were also there to listen, and I really just needed a lot of listening with this pregnancy. And the need to connect was huge, because I definitely felt like I couldn't connect to my family and friends like I did and have been doing with life prior to COVID, I guess. I'm a school teacher as well, and that was really just a huge shift to try and reach all of my students too, as much as I care for them so much. And, you know, being a mother, pregnant, and teaching was just, I just want to give another shout out to everyone helping mothers right now, and pregnant mothers, of course. So anyway, I was hoping to give birth at the birth center, but this little one did not want to come. No, he was over 2 weeks late, well over 2 weeks late. And so we went to Mission, and that was actually a really big fear of mine. I didn't want to go to the hospital, mostly because of COVID. And luckily it was wonderful. I felt welcome, I felt safe. I was really surprised actually, because that was the last place I wanted to give birth. I would have rather have a home birth than go to the hospital. And mostly, again, that was because of the fear of COVID. But my first birth was at the hospital, so I had some experience there. And it was wonderful. And again, the second one was wonderful. I had a very healthy birth. And I just want to say that, you know, if you're a mom and expecting a baby, please don't be afraid to reach out. I felt like I couldn't at first. I was tough, I'm strong, I'm independent. But the best thing I did for myself was reach out and yeah, you have these wonderful organizations, wonderful people willing to work no matter what to help meet your needs despite having a pandemic surrounding you. So yeah, I think that's what I got.
Well, we congratulate you, and Chris, thank you for for your willingness to be vulnerable on this platform, and also to really bring that very fresh, direct personal experience to this conversation. And I think one thing that very much stands out for me, and perhaps others that are that were listening, is the art of listening, and how that is a very key component to the birthing and the pregnancy experience. So I'm glad to hear that at least you were able to get some of that. And so with that, I think that this is perfect time for us to welcome someone who is very attuned to listening, and that is Kimberly Williams, who is a breastfeeding peer counselor. Kimberly, the floor is yours.
Hello, everyone. I am Kimberly Williams. I am a breastfeeding peer counselor with WIC. I have been doing this job for the last 2.5 years. I very much enjoy it. A peer counselor is someone who is experienced. I have 2 children of my own, and I breastfed them both. And I am also a woman of the Buncombe County community. I was born and raised in Asheville, attended Asheville High. Hey, Cougars. I also help support mothers in not just problems and trouble that comes with breastfeeding, but I was a cheerleader, and I'm still a cheerleader because I like to cheer my participants on. I want them to feel empowered. I want them to feel confident and make informed and well-educated decisions when it comes to how, when, and where they decide to breastfeed. A lot of struggles that we have with breastfeeding is how long to breastfeed, what to do when a mother returns back to work. And so these are the things that I would be counseling my mothers on. Since COVID-19, everything I've done is over the telephone. I do lots of referrals to other organizations such as NFP, the Mission Breastfeeding Center. We also work closely with Sisters Caring for Sisters, because prenatal education is just as important as postnatal education. So we all like to coordinate with one another because we like to double, triple, quadruple the support down on all of the women in our communities so that we have a very healthy community. And working with WIC is supporting them through having a peer counselor on site. There are 2 of us downtown at the Cox Avenue location. It is also a supplemental nutrition program. So when families are having struggles with trying to provide food in their homes, these are the mothers that we want to come in so that we can help with these types of problems, so that everyone feels like they're being well taken care of, especially the children in our community. And these are very nutritious foods that come in WIC packages. So when people are discussing, well, I can't eat healthy because it's too expensive, that's what WIC is there for. We want to be able to help you afford those healthy fruits and vegetables, those whole grains, and foods that are going to help your body to grow and be healthy for mothers and babies. With my experience with WIC, I was with WIC for both my children. I'm still currently a WIC participant. I had 2 different experiences with my breastfeeding. The first one was very smooth, very easy, very, very organic, very natural. With my second child being that he was premature, we did struggle a little bit, but because I was a WIC participant, I was able to go in and receive a breast pump. So we do have those available as well, and a lot of mothers call us about them all the time. And so we try to meet that need when that need is given to us to handle. We want to make sure that if you plan to breastfeed, you are able to do it, and we want you to be successful with it. I am also very well connected in our community. My father is the manager over at what used to be Reed Center. It is now the Eddington Center. My sister works for the county as well. My mother used to work for the county, so I'm very much rooted in my community to help my community. So I'm hoping that the women that see this, if they see me out in the streets, a lot of my mothers have, and they say, "Hey, breastfeeding lady." That's what I don't mind. That's a nickname I could take to the grave, definitely. I love, love, love the fact that mothers want their babies to be healthy, and they've chosen breastfeeding as the healthiest way to feed their babies. Thank you.
Well, thank you so much, Kimberly. And, you know, it does make all the difference to have a cheerleader on. And it does make a difference to have a familiar face who knows the community and can really make sure that, you know, all of those local connections are made available to our moms. So thanks for sharing your story, and then also making the connection to WIC, which is another program that Buncombe County is supporting and is available to moms and some little ones as well. I'm hearing too that there are lots of opportunities where moms can get actually some additional support who are on WIC that they may not even be aware of. Can you speak just briefly on that?
So we do a lot of referrals, like I said, to the other programs as far as care coordinators go. We refer out to Georgiana, who is up next, very much because I'm not allowed to see my participants at the moment. And usually I do a lot of hands-on work with them when there are problems, but at the moment I can't. So I have to farm everything out to someone else and hope that they can do as good a job as I do. Also with WIC, we have lots and lots of incentives. So when parents have things such as baby utensils, when children are growing and they are starting to learn how to eat and eat table food, we have different incentives to not only keep our participants in the program, but to help them out in their homes, giving them tips on what to feed baby, giving them tips on how to stay healthy, keeping up with the exercise, drinking lots of water. We have many different breast pumps that we are able to issue out to our participants. And so we ask them, you know, as they're going through their breastfeeding journey, what they're going to be doing, because we want to help support them so they can continue and get all the way through the amount of time that they want to breastfeed. And it's up to the participant, but we want to be there to help you get all the way there and not stop before and feel like I didn't do what I should have done. And we don't want to make them feel as if they're a failure if they do stop. Because even if you stop, I'm like, you've tried it. And that is something to be proud of in itself. And so from that it goes forward and more, and the longer and longer they go, the better they feel, the more confident they feel, the more empowered they feel.
Well, thank you so much, Kimberly,
Yes,
for sharing all of your experiences around being a peer breastfeeding counselor. And next, we are so honored to welcome one of our regional leaders, actually the public health region North Carolina Lactation Region 1 leader, Georgiana Cogburn. Welcome.
Hello. As I have been listening to everyone share, I've made some notes, and I was reflecting back on the message. As region lactation trainers, we were tasked to put out to all of our local health departments starting probably in May of this year, and how every week we would read the statements from the World Health Organization, from the CDC, from the American Academy of Pediatrics, and from all of our professional groups, and looking at how those have changed. And really, as Chris shared, really for the betterment of our moms. A lot of these things we were hearing early on have changed. So I want to share with y'all some of the key messages that we should be giving our patients now in relation to breastfeeding. We should be supporting breastfeeding and encouraging breastfeeding for all infants, whether it's newborns or an older infant. From the beginning Everything was like, well, in the hospital, mom and baby should be separated. They shouldn't be together. And what we know now is the best place for mom and babies is together, unless that mom is too sick to care for her infant. That mom and babies need to be together in the hospital, and that they should be encouraged and supported to breastfeed. The infant should be placed immediately skin to skin with the mom after delivery and should stay there till after their first feeding or for that first hour after delivery. That is so important to our infants. It maintains their body temperature, it controls their blood glucose levels, it maintains their respiration. And they should continue to do skin-to-skin care throughout their hospital stay. And the only time this should be interrupted is if mom and baby are too sick to be together. All families should receive practical breastfeeding support, whether it's from their peer counselor, from the doula, or as Kimberly mentioned, I'm referring them out. My mom's out to other resources, to those resources that are there to help our moms and babies. When moms and babies are separated, it's going to disrupt the natural bonding process and would increase the stress level for our moms. And when moms are stressed, their cortisol levels go up. And I remember hearing Chris talk about all of the stress around that. And that's tough on moms, having those high cortisol levels. So being aware of that and how when those cortisol levels are high, it can easily undermine bonding and breastfeeding. And one of the things I don't think was thought about early on is if they were separating moms and babies in the hospital, when they were discharged from the hospital, they were put in the same car to go home. They were no longer able to be separated. A lot of our babies and moms went to a very small house and there was no place to separate them. So by keeping that mom and baby together helps to continue that process. When we look at the messages now around breastfeeding and COVID-19, here are the basic guidelines that we should practice respiratory and hand hygiene, whether it's a newborn or a parent who gets sick with a 6-month-old baby. Moms should be washing their hands frequently with soap and water. When they're feeding the baby or caring for the baby, they need to make sure that they are wearing a face covering. If they cough or they sneeze, they need to do that into a tissue, which they need to immediately discard. At one point, there was information coming out about if mom coughs, she needs to wash her breast. That is only if her breast is uncovered. So if she has on her shirt, then what happens is her breast is protected and she would only need to wash her breast if she coughed and the breast was uncovered. And if the parent happens to be too sick to breastfeed her infant or to provide care for her infant, that parent should be provided with a dedicated breast pump to be able to express breast milk so that someone who is in the household who is not too sick to help care for the infant is able to provide that express breast milk to the infant. That's where knowing your resources come in, like knowing that WIC has electric breast pumps for our moms, or knowing that if they're not on WIC, that they can get it from the hospital, making sure parents know where to get those resources, and making sure that the mom knows to stay with baby unless she is too sick to feed the baby, using the respiratory hygiene and the hand washing care. And we want to make sure that we know where to connect our families to in our community for support, to the WIC program, to the breastfeeding center that's affiliated with the hospitals in our communities. La Leche League has an online support group. Classes through community groups such as Homegrown Families. And then if you're a health professional and you're going, I don't know enough to be able to answer our patients' questions, to guide them, through MAHEC, we do provide ongoing breastfeeding education for health professionals, so if you've got coworkers who are saying, I don't know how to answer these questions from our parents, please connect them with the training and education that's available.
Thank you so much for all of that, Georgiana. I do have another question. So I know you've talked about what obviously some of the best practice, whether it's from World Health Organization or the CDC, that families and moms. Can you share a little bit more about any recommendations, or at least point our viewers and listeners today where they might get support if they are a business owner or an employer, and how they can actually help those women and families, or possibly even their customers who are breastfeeding?
So, yeah, so the same things that we just went over really apply to business owners, that it's your job as a business owner, if you have an employee, to provide them with the place and the time to be able to pump or to nurse their infant, and to provide a safe place to do that. Workwell, North Carolina has a lot of resources for employers to walk you through establishing a place for women to be able to breastfeed, setting up policies to be able to do that. So when you're thinking employment is general, supporting customers that may come into your business, Workwell NC has a ton of resources to help with that.
Wonderful. That is very, very helpful. And so that is all of our panelists for now. And with that, we'd like to open up the conversation to address some of the questions that are coming in from the chat. So the first question that we have, and this is a question for anyone or all of our panelists really, the question is, as a community, what can we do to make sure that expecting moms, families, and infants remain safe in our community? So I'll let anyone who wants to be the first respondent to that question reply. So Kimberly, were you going to unmute yourself and chime in?
My tiny chihuahua has decided to chime in for me. From a breastfeeding mother standpoint, I would say definitely when you see them out in the community, to not overcrowd them. I know people love to see babies, but we would really rather you not be up close to the children. You still need to be 6 feet apart. Please don't make them feel uncomfortable. We have the hardest time with our mothers wanting to go out with their children because they don't feel comfortable breastfeeding. Give them the okay is what they want. They want that eye that says, you're doing good, instead of that eye that says, what are you doing? That would go a very long way to a breastfeeding mother to help her feel very confident and very comfortable with what she's trying to do to keep her child healthy and strong.
I think the message that we are tasked as public health to give to everybody, using wearing our face mask, waiting the 6 feet apart, washing our hands, it protects everybody. It protects our pregnant women, it protects our children, it protects our babies. And that's the message, the public health message that we need to be getting out there to everybody.
Thank you so much. Do we have anyone else that has anything that they see, at least from their work site or at least personally, that they'd like to share with the public?
I would agree to like maintain. To maintain the 3 W's, and then also just recognizing like the long-term effects of COVID and the stress and the toll it takes on families, on their health. And I think as we move forward and we recover through this, supporting policies that support families, that center equity, social justice, and center the voices of people most affected by COVID in our community as we move forward is important, and families. So.
Wonderful, thank you. And so I do want to share that we have had a comment that's been shared from one of our participants who's viewing online. And this is from a Natasha Bowden. She is with Buncombe County Partnerships for Children. And what she's sharing is that for any businesses or child care centers who are interested in creating a breastfeeding friendly environment or policies, that she's available. And she can be emailed at natasha@buncomepfc.org. That's natasha@buncomepfc.org. So we do have another question that has come in, and this is, and I'll leave it to all of our panelists who may be able to chime in, especially those who are seeing patients, is that for some, COVID-19 has meant weight gain. What are you all seeing with your clients or personally? As we know, moms often face cravings. So that's a little bit more on the maternal side, but it's definitely much lighter than some of the subjects that we covered today. So any changes or any ideas? What have you been hearing?
Well, in the pregnancy world, I know our providers are still encouraging our pregnant women to get out. The same applies, even though they're out in the restaurants and things, nature still applies. Our pregnant women are still encouraged to exercise outdoors safely. Of course, this isn't a time to lose weight, but to maintain that 25 to 30 pound weight gain during pregnancy. Even though COVID is a difficult time during COVID with weight gain, that hasn't changed as far as pregnancy is concerned, as far as those guidelines. And I know it's difficult for all of us, pregnant or not, with that COVID weight gain. But I know those guidelines haven't changed for our pregnant women and what our providers are encouraging.
And from the nutritionist standpoint, when that question comes up, is think about the food choices that you're making. Can you make a healthier food choice, like a fresh piece of fruit versus a bag of chips? Making the healthier food choice will also help with not packing on those extra pounds during a time that you may be more sedentary.
I'll chime in from being pregnant and craving donuts every day. I definitely did not have donuts every day, but I definitely allowed myself a donut, but I'd also get outside and move. And not only getting outside safely and moving helped with dietary and weight gain issues, but it also helped with my stress. Moving really does help me manage that a lot better than just being sedentary.
Thank you. So we do have another question, and this is, what resources are there for moms to connect with other moms? Social distance right now. So I imagine this may be Facebook groups or any online forums. If anyone is connected to any of those, that may be able to share a resource?
We reference our mothers to Ready, Set, Baby. It's a virtual Zoom for prenatal classes. I encourage my prenatals very much so to sit in on them, even if they don't want to talk or show the video, only because it gets them information that they need, but also they can see what other people are thinking and getting answers to. And sometimes it is a connection because you see someone else on there and you're like, this person lives close by me. I would like to get to know them so that we can talk about this, especially if they're very close into their due dates. Knowing another mother is having a baby around the same time that you are can very much help when you're talking to them, because you get to bounce these different ideas off of each other. You get to tell each other how you're feeling, and that's the one person you know is probably going to understand what you're going through.
And so this question, I don't know if there's anyone who, has actually had this experience themselves. This is for women returning to the workplace following a birth. What changes, if any, have you seen with employers during COVID? So this is somewhat related to that prior question around employers and their supporting breastfeeding. However, I think maybe Denise or Claire, Georgiana, and I open it to everyone. Kimberly and Nikita, you obviously could reflect on this. What are you seeing in terms of how to support moms who may be getting back to the workforce during COVID?
What I can
Who are
say to
within
that
there?
is, for moms that have like a high risk job, like if they're working in a real public place or if they're working in a nursing home, a lot of moms aren't wanting to go back to work because they're not wanting that extra exposure for their families or that newborn that's at home. So what's happening is a lot of moms are having babies and then they're just staying home because in the industry that they're working in, the community moms in industries that they're working in are high risk and they don't want the exposure. So, and then it's like people are looking at them like, oh, she's lazy and doesn't want to go to work, not understanding her backstory. She might have her mom at home, her newborn at home, and not wanting to put anybody at that risk.
Yeah, Nikita, I've heard that a lot too. And I've also heard that in the past where they would have been going back to work and stopping breastfeeding, a lot of them are opting for longer term breastfeeding for the protection that it gives to their baby, the health benefits for their baby. But I'm hearing a lot of parents aren't wanting to go back to work, that they're deferring that, and in some situations where they're able to telecommute or work from home, that they're doing that.
I also want to add, and I totally 100% agree and hear that. And also if childcare is involved, the new policies with drop off of like, you don't go in, so you leave your kid, like because of COVID. So, it's already like a big shift to go back to work, and then, finding childcare that's open, that feels safe, but also, it's hard to make that transition. So,
So I'm aware of the time, and I see that we are close to the kind of final minute of our conversation, and want to add that before we get one kind of parting takeaway from each of our panelists, wanted to share that there was a comment on Facebook, and this is from the La Leche League, saying that they actually have online meetings that are open to moms who are breastfeeding or want to learn more. And this is La Leche League Bunkum NC, and you can find it by searching on Facebook in groups. So we will now do another round robin and get a quick signing off takeaway from each of our panelists, and we'll I guess proceed in the same order again and start with you, Denise. One parting message for our viewers today, please.
I just want to say thank you for tuning in. Just know that we're here for you. If you need us, pregnancy care managers are here in Buncombe County in just about every practice here. And You can ask for us through your provider, or again, at Buncombe County Department of Health and Human Services. We're here to help you. We want to make sure that you ladies have a full-term healthy pregnancy outcome, and we do whatever it takes to make sure that happens. Thank you.
And Claire?
Yes, thank you everyone for tuning in. And same, I mean, we're here, Nurse Family Partnership is here. We're accepting referrals and just want to give all the love and support to families out in our community right now. And this is random from another question, but I also want to say, I think Homegrown Families maybe is doing some virtual meeting spaces for families to connect. So I wanted to look it up real quick, but I think it's happening too. So just another option. But and I just want to say too that the community, I feel like it's such a good how we support each other too through this work. So I honor that very much.
Thanks, Claire. Next up, I guess we'll hear our takeaway from Nikita. Nikita, you're welcome.
Okay, I'm sorry. No, my takeaway would be support, support, support. Like, there's so many beautiful women on this panel, and we all work to support the same thing for our moms and our babies to be healthy and have the best experience possible. So anything the community can do to support the work of these women and the work of our moms would just be awesome.
I second that. And Chris?
Chris Shriver, thank you all for allowing me to be a part of this panel as a mom. And yeah, to all you expecting mothers and anyone who is going forth with motherhood during this time, you're awesome. We got this, and we have a community more than willing to help and support us.
And Kimberly?
Sorry.
Okay.
Thank you all for tuning in. Definitely go out and be supportive to each other, be supportive to breastfeeding mothers, and any woman in this community that you feel like you can give a helping hand.
Okay.
And Georgiana to close us.
Yeah, I think when I think of our take-home message, that support for all of our families, for breastfeeding, for childbirth, for anything that they need that they're going through, and knowing those resources in our community to connect those parents with, because right now is such a hard time. Connecting families with those resources is of utmost importance.
Well, thank you all, and we appreciate everything that was offered during this panel in terms of the deep listening, the connection, and the resources, as we know that they're really key to ensuring maternal health and infant health. And so the conversation does continue in the coming weeks. We will also hold follow-up conversations where we'll hear from other community contributors around early childhood education. And later this fall, we'll be hearing from our area students on where we'll have actually a student-moderated conversation to hear from youth voices as we follow a life course projection in this Let's Talk COVID conversation. So I thank you all. To all of our participants, we encourage you to please reshare this conversation. It's available on Facebook, it's available on YouTube, and remember, as part of our commitment to language justice, this conversation has already been made available in Spanish. So until next time, we say thank you and be well and stay safe.